was only in November last year that George Osborne first floated the idea of these cuts to nurse bursaries. Since then, we have seen the official announcement by the Department of Health. They've said that they will be cutting the nurse bursaries and that anybody who wants to apply to be a student nurse will have to use the student loan system instead, just like any other student. Now, the government's hoping this will tackle the problem of the shortage of NHS nurses that's going on in the UK right now, and as well as freeing up around £800 million a year in the government's budget. Of course, the Royal College of Nursing and many student union bodies who represent student nurses disagree with this policy, which is why they're gathering here today outside Parliament. In fact, right now they've just crossed Waterloo Bridge and they're heading towards Parliament, off towards Downing Street, where they'll hold a protest, including some speeches. Earlier on, I spoke to Gail Adams. She represents the nurses from the group Unison, and she explained why she was supporting the protest.
We are supporting students today, healthcare students, who, under George Osborne's plans, will see their NHS bursary scrapped from 2017. So we're here to show our support and to also oppose it and encourage the government to think again.
Now, the argument from the government is that they can't afford to support everyone they need to fill the shortfall of nurses in the UK. 10,000 places would be opened up by scrapping this bursary, as well as £800 million in budget. Is this, not the best way to proceed?
It's most definitely not the way to do this. There is a shortage of nursing, but the reason that there's a shortage of nursing is that this government cut student nurse training places in 2010. It takes 3 years to train a nurse, and that's why we've got the current shortage. Our NHS workforce are our most valuable asset, and we'll do little, if anything, to encourage people to join the profession if from 2017 we condemn them to a minimum of £51,000 worth of debt. Government are also committed to continuing pay austerity, which means that they'll graduate in 2020 with a starting salary of £22,000. They will never pay this debt off. It is a falsehood to claim that it will save the public money. It just simply is not true, because the debt will never be able to be paid off. A student would have to qualify and be on an 8B, which is over £60,000 per annum, in order to afford to pay this off. And it is a minority of nurses and midwives who ever achieve that level of pay.
2/3 of people currently turned away every time they want to, from the people who want to become nurses and train to be nurses. Is this loan system not a better way to get people into the system, because they'll be freeing up those spaces rather than having to turn people away?
Well, actually, those figures aren't accurate. The government are misleading the public at this moment in time. There are a number of people who apply for student nurse training places, but actually the bursary acts as an incentive. It encourages people to apply for nursing because they get a very small bursary, but also they get the tuition fees paid for. And that, I think, is the best way to do it. I'm quite happy to have a conversation with government around actually the future of healthcare training and funding, but I'm not prepared to allow them to throw the baby out with the bathwater and risk patient safety by having an inadequate and an untrained workforce in 2020. And that will be the signal, because people will not be able to afford to come into nursing. I didn't come into nursing to become a multimillionaire, but I was very fortunate. When I trained, I had financial support. If I hadn't have had that, I wouldn't have been able to have entered the profession.
Now, this protest comes as around 151,000 people signed a petition for Parliament to debate this. That'll happen early next week. We did put the concerns of the student nurses who are protesting here today to the Department of Health, and here's what they had to say. We need more homegrown nurses in the NHS because they do an amazing job caring for patients. But currently, 2/3 of people who apply to become a nurse aren't accepted for training. Our plans mean up to 10,000 more training places by the end of this Parliament, with student nurses getting around 25% more financial support while they study. Now, today's march comes as hundreds, if not thousands, of people prepare to strike on a connected but separate issue. That's the issue of the junior doctors' contracts. They're still planned for Tuesday, these strikes, going from Tuesday to Wednesday after talks failed last week, according to reports. Talks between the British Medical Association and NHS employers had been constructive, but the two sides were not able to prevent the industrial action planned. Now, the strike is heading down the road here. It's heading towards Whitehall. We'll be following the protest as it goes on. We'll bring you more as it develops coming up. I imagine we'll be outside Downing Street by the time you come back to us. More on this as it develops.